So let's talk about something that affects pretty much all of us, but often flies completely under the radar. It's this hidden barrier that stands between us and our own health, and it all starts with a very, very familiar feeling.
You know exactly what I'm talking about, right? You're in the office, you're nodding along while the doctor explains everything, but the second you get to your car, you realize you're not totally sure what you're supposed to do next. If that sounds even a little familiar, trust me, you are not alone.
Not even close. In fact, the Institute of Medicine found that nearly 90 million adults in the US have a hard time understanding and then acting on health information. Think about that. That's more than a third of all adults. And this has nothing to do with how smart someone is. It's about a specific skill gap that has absolutely massive consequences. So what is this thing we're actually talking about? Well, this feeling of confusion, this gap in understanding, it has a name: health literacy. But it is so much more than just being able to read a pamphlet. See, the official definition shows you it's a whole process. First, you have to be able to find the information you need. Then you have to process it, make sense of a confusing prescription label or a complicated diagnosis. And finally, you have to use that understanding to make the best possible decisions for yourself. It's a really active, critical skill. And of course, in our world today, there's a whole other layer to this: digital health literacy. This is all about navigating the giant, overwhelming sea of online health information and misinformation, which some people call the infodemic. It's knowing how to spot a reliable source, figure out if it's credible, and then apply what you learn to your own life. Okay, so why does this matter so much? Well, this isn't just some abstract idea. The stakes are incredibly high. When our understanding of our own health breaks down, the consequences can be really, really serious. And they don't just affect us as individuals. They affect the entire healthcare system. One of the trickiest parts of this whole issue is that it's invisible. You can't tell what a person's health literacy level is just by looking at them. It has nothing to do with their job or how well they speak. So instead, clinicians are trained to look for certain behaviors, little red flags. Things like frequently missed appointments, forms that aren't filled out all the way, or a patient not being able to explain how they're supposed to take their own medicine. These are all just clues that someone might be struggling to keep up. Let's make this really concrete. Picture this: you're a parent and your child has asthma. Managing that is a whole chain of pretty complex tasks, right? You have to understand the treatment plan, know how to use an inhaler correctly, explain everything to your child's teachers. Each one of those steps can become a huge hurdle if health literacy is low. And that can lead to real problems, like using an inhaler the wrong way or forgetting to give medication when the child seems fine. And that really gets to the heart of the ripple effect here. A breakdown in understanding doesn't just stop with the patient. It affects their family, who might be trying to care for them. It affects their community. It even affects the healthcare professionals who are trying their best to help. It becomes a problem for everyone. And yep, there is a staggering financial cost. The data shows that the annual healthcare costs for someone with low health literacy can be up to 4 times greater than for someone with high literacy. 4 times! That's often because of more hospital stays and more ER visits, all of which can stem from that initial confusion. So, okay, the problem feels massive, complex, and super costly. But here's the really cool part. The solution? It's surprisingly simple. It all comes down to one powerful shift in how we think about it. This is the big aha moment. Instead of trying to guess who might be struggling, the universal precautions approach says, let's just assume everyone could benefit from clearer communication. Let's make things simple and clear for every single patient. By doing that, you create a system that helps everybody, you get rid of the shame, and you make healthcare safer across the board. Now, this mindset isn't just a nice, feel-good idea. It actually comes with a whole toolkit of practical, proven strategies. So, how do you actually put this powerful idea into practice? Well, the heart of it is something called the teach-back method, and it's as simple as it sounds. First, the clinician explains something, then they ask the patient to explain it back in their own words. Not like a test, but by saying something like, I want to make sure I did a good job explaining that. Can you tell me what you're going to do when you get home? And finally, if anything's unclear, the clinician explains it a different way and checks again. And this is the most critical part of the whole thing. Teachback is not a quiz for the patient. It's a check on how well the doctor explains something. This little switch completely changes the dynamic. It takes all the pressure and shame off the patient and puts the responsibility for clear communication right where it should be, on the person doing the explaining. What this simple process creates is a powerful feedback loop. It's not a one-way street where a doctor just dumps information. It's a conversation. The clinician explains, then they listen to assess understanding, and then they can tailor their explanation until they know the patient truly gets it. That loop is what leads to real comprehension and, down the line, better health.
So Teachback is the star of the show, but it's part of a bigger strategy. It's all about keeping things simple and reinforcing the message. That means using plain, everyday language, focusing on just a few key points instead of overwhelming people, and using pictures or models to make things stick. It's all about repeating what's most important, and, maybe most of all, creating a positive vibe where people feel comfortable asking questions.
But look, improving health literacy isn't just a job for doctors and nurses. It really takes a commitment from everyone who has a hand in healthcare, from the people who make policy, to insurance companies, and yes, to patients and our families. It's on all of us.
So I want to leave you with this thought. We pour billions and billions of dollars into developing new drugs and fancy medical technologies. But what if one of the most powerful, life-saving medicines we have doesn't come in a bottle at all? What if it's just clear, simple understanding? That's the real power of health literacy.